Welcome, everyone. We're here today to learn about hearing aids. And with me, I have one of our audiologists, and I'm going to ask her to introduce herself.
Hi, everyone. My name is Michelle Arbini. I'm our lead audiologist here at Valley in our ear, nose, and throat clinic.
Let's start with our first question. What is an audiologist, and what do you do for patients?
An audiologist is a healthcare professional that will identify, assess, and manage hearing disorders such as hearing loss, tinnitus, which is ringing in the ears, and balance problems.
What are the benefits of being fitted for a hearing aid?
Some of the benefits of being fitted with a hearing aid include improved memory, improved cognition, improved social engagement, and connections with family and friends.
What are the potential problems of having untreated hearing loss?
Untreated hearing loss has been associated with cognitive impairment, dementias, lack of social engagement, depression, anxiety, stress, and also an increased risk of falls.
What can you tell us about over-the-counter hearing aids?
Over-the-counter hearing aids are a new category of hearing aids that can be purchased by individuals that are 18 years or older that have a perceived hearing loss that is mild or moderate in nature. These devices can be purchased without a hearing exam or medical consultation. The over-the-counter hearing aid is more of a one-size-fits-all type option for patients. It's important to understand that there's no precision in this type of hearing aid fitting. Our obvious concern is that patients will not be effectively treated for their hearing loss and will be at risk for some of the long-term effects of untreated hearing loss.
What are the benefits of having an audiologist fit you for a medical-grade hearing aid versus buying one over the counter?
The benefit of having an audiologist fit you with a medical-grade hearing aid allows for specific selection of the hearing aid based on your audiogram. The devices are then programmed and verified to be appropriate for your hearing loss. And then we do orientation and training and counseling, as well as follow-up care over time.
How does an audiologist fit you for a hearing aid?
The audiologist will take your audiometric information, program your hearing aid, and then in the office, we're able to verify that the hearing aid is appropriate for your hearing loss. We also adjust specific features such as noise reduction and directional microphones to make sure it's working in all your listening environments.
What can you tell us about the latest technology available for hearing aids?
The latest updates in hearing aid technology are allowing for clearer sound quality and improved listening in noisy environments.
If you think you might need a hearing aid or a loved one might need one, what should you do next?
We strongly encourage you to address hearing loss with your primary care provider. Most primary care providers will refer you to the ear, nose, and throat clinic to see one of our doctors, which will include a hearing evaluation. This evaluation will give us an idea of the degree and nature of your hearing loss, as well as any medical intervention that may be needed.
Thank you for answering our questions today. And for those of you watching, we encourage you to go to the web link to learn more about our ear, nose, throat clinic and other services at Valley.